Good evening, Professor Patterson and dear classmates. This is Mohammad. The healthcare system in France is based on universal healthcare model and financed primarily through the government, who provides national health insurance for about 99% of the population. The French healthcare system is considered to be comprehensive and complete, and the 2010 analysis by WHO found that France was near the top of the list in providing the best healthcare in the world. The overall spending on healthcare is over 11% per capita, which is higher than many other universal-based countries, but still it's lower than the United States spending. The public insurance funds pay for the salaries of providers, so most of the healthcare professionals are paid through the government. However, the coverage in the country is not 100%. The government generally reimburses patients around 70% of their healthcare costs, requiring that remainder be paid out of their pocket, except in case of long-term illness that can be expensive, which then the government covers all 100% of the cost. The citizens do have an option to purchase private coverages as well to make up the 30% which is not covered by the government, but that's purely option. It's very common as around 99% of the citizens who do have access to subsidized plans through the employers take advantage of them, and the total about 85% of populations has an additional private plan. The universal model in France is relatively new and didn't get implemented till year 2000. Prior to that, only the individual who contributed to Social Security were allowed coverage. Working citizens still are required to pay for Social Security fund that pays for their health care. In order to pay for the universal coverage, earned income is taxed about 5.25%, and other forms of income such as winnings or pensions are taxed about 3.95%. While everyone has access to the care, the way which is provided is very interesting, and it's funneled through a system that is designed to keep individuals simply from using care just because it's there. The general practitioners are frontline individuals in French healthcare system. They are expected to act as doorkeepers for patients and provide referrals for them to move to see another facility, another doctor, or simply just handle the problem over there. The purpose of this is to keep individuals from repeatedly moving from doctor to doctor. However, the citizens are not restricted who they can see on their first consultation. They may choose a specialist or even a doctor who can refer them to the next level of care. Essentially, there is a high level of choices in French healthcare system. In addition to this doorkeeper system, the government also reduces reimbursements for expenses when a patient goes from doctor to doctor, which ultimately can cause the patients a great deal. While there is freedom of choices, this method really restricts the movement of patients in order to reduce the amount of healthcare that is used and wasted in the country. Per capita, there are more doctors in France than in many other developed nations, including the United States. As stated earlier, the government reimburses up to 70% of expenses in most of the cases. But those reimbursements are based on the rules of assurance maladie, which is the listing of fees that providers are supposed to charge. In heavy urban areas such as Paris, the doctor fees are of course significantly higher, but the government is still only reimbursed based on the fees listed on the assurance maladie, thus making it essential for most citizens to carry some level of private coverage. Private insurance is provided through non-profit insurance companies, which is usually funding through an employer, and the employers are required at least to pay 50% of the cost of the plan. Finally, of note, one of the most aspects in French system is the way in which it treats those who are chronically ill or any other types of serious illness they have. The more when a person is sick, the less they pay. For example, perfectly healthy individuals who are receiving preventive treatment, they will have to pay 30% of their cost, still contributing to Social Security through taxes. but someone with cancers will be covered the whole 100%, even though they are not working. Essentially, the healthcare system focuses on providing care for those who need it the most, and the able-bodied working citizens help to bolster the public funding. Overall, France has an impressive healthcare system that WHO has drawn attention to on several occasions. The universal model, funded through taxes, provides coverage for about 99% of the population. The healthy populace covers 30% of their cost, unless covered through additional private insurance. And those who are very ill receive full coverage. Overall, this is a very solid system and does an excellent job for covering its citizens. So, thank you for attention.